Now we are going to perform inferior shoulder instability or multidirectional shoulder instability test. First we are going to do Sulcus Sign, then we are going to perform Feagin Test. Alright, now we are going to perform inferior shoulder instability, Sulcus Sign. Patient should be in standing position. Then we have to grab the arm just beneath the elbow level and we have to apply a downward force. While doing this, if there is some indentation or if there is some depression just beneath the acromion process, that is called sulcus sign. That indicates that patient have a inferior shoulder instability at the glenohumeral joint. And we can grade this one while doing this if the gap between just beneath the acromion process and the head of the humerus, if the distance is more or less 1 centimeter, that we can grade as a grade 1. If it is more than 1 centimeter to 2 centimeter, then we have to grade it as a grade 2, and if that is more than 2 centimeter to 3 centimeter, then we have to grade it as a grade 3. If we can do this test to 20 to 50 degree abduction, that can give a promising result. Today we are going to perform Feagin Test. We do this test for inferior shoulder instability or multidirectional shoulder instability. We can do this test in two procedures. One should be in sitting and one we could be done it in standing position. Here we are going to perform first in standing position, then we are going to perform it in sitting position. So in standing position, we have to take the arm in 90 degree position and we have to take the arm on the examiner's shoulder. Elbow should be straight. Shoulder should be 90 degree abduction. Then we have to clasp our arm like this. Then we have to place our arm on the upper and middle 1/3 of the humerus and we have to put a downward and forward pressure like this. Now we are going to perform Feagin Test in sitting position. Patient should be in sitting position. Then examiner should grab the elbow and extend it 90 degree and shoulder should be 90 degree abduction. Then we have to apply a downward pressure on top of the humeral head, and while doing this, if there is some depression on just below the coracoid process or patient has the apprehension or fear of pain or dislocation, that we have to consider a positive anterior inferior instability of the shoulder joint. And while doing this, that examiner can grab and control the movement in a proper way. So that is the biggest plus point of this test for inferior shoulder instability. And one more thing we will add, like while doing this test, if this test is positive and the sulcus sign is also positive, then there will be greater chance that patient has a inferior shoulder instability and it could be a multidirectional shoulder instability. So this is all about Feagin Test.